Good morning. I thought I'd come online while I have time and answer a couple of questions that I was asked in the comments about clenching and grinding. I'm just gonna allow more people to join, so if they have any questions, they can also ask. This is a beautiful morning. I'm going to work. It's a bit chilly, but not so much. It's summer, and we only had actual nice days for a week, I would say. But in Melbourne, we will take whatever we can from the weather because the next moment it's going to change and it's going to be rainy or hailing or storming. You never know. So, today's topic was about a couple of questions I got in the comments, and most of them were about grinding. When I sleep, I grind. How can I help it? And it's really important to know that. Oh, oh, sorry. It's really important to know that clenching or grinding is a habit. It's not something that you can consciously stop because it is subconscious. It usually does happen when people are stressed, but not only that. It can be that your bite is not correct, or you are stressed, or it's called a parafunctional habit. Now, how do we help that? How can we, because clenching and grinding can cause a lot of um, teeth to break. It can cause a lot of damage to your muscles, to your joints, to your TMJs, which is the worst thing because the older you get, you're going to get so many problems in this area. And I had to treat patients who absolutely basically had no tooth left. The tooth, whatever was left of it, was healthy. It was just the fact that it was completely broken to the stem. So, how can we prevent this when we are older? Most importantly is relaxation therapy, meditation, yoga, whatever that can put your mind in ease. And I know that it's difficult because I grind myself, and it's really hard with the modern life to be able to stop yourself from stressing or thinking. And you have to be a very good, accomplished meditator to be able to stop grinding, or at least to stop yourself from stressing, because especially as I said, living a modern life, there's always something else that's going to stress you. So the first step is to work on your mind, be able to relax your mind, especially before sleep. So if you can do that before you go to bed, you're already winning. That's one. Second one, usually dentists would recommend to wear a guard. It's called a splint, occlusal splint, night guard, whatever you can call it, sleeping guard. But basically, it's made of two different layers of plastic, one hard, one soft. Some would only make it soft, some would only make it hard. But the best and the most comfortable and effective one is hard and soft. Now, the inside where it touches your teeth is a bit more soft, and the outside where you're biting on is harder. And it's very important that the surface is flat. So it's called a flat surface splint. Why is that? Because if it has grooves in it, the shape of your teeth, you're just going to basically chew on them. It's very important for it not to be super soft because your mouth will use it as a gum, basically it keeps chewing and clenching and grinding. So the best way to make a splint would be hard and soft, or only hard, but people don't like it, it's really uncomfortable. And also with a flat occlusal surface, flat surface for the person who's going to wear it to bite on. These you have to get used to. It's not something that from the day one, from the night one, everybody's happy to wear it. I would say honestly, based on when I ask my patients, how's your guard going? 10% would wear it. Most people would just pay for it and throw it somewhere as if paying for it will stop your grinding. But if you can wear it, it has a really good effect. Hygienically, keep in mind that you have to change it. I would say once a year. They're not cheap, but they become really yucky and yellow, and you cannot clean them. So that's the second. The third option would be to um, use injectables like Botox, which basically any other brand, as long as they are paralyzing the muscle, the masseter muscle, it's going to stop you or prevent you from excessive grinding. So it's not only limited to Botox, basically any anti-wrinkle injectable. It's injected into masseter muscle here and here. And the masseter muscle is one of the very important muscles that will close your jaw and causes clenching. So there are four muscles of mastication, but this is one of the most important ones when it comes to clenching. If you do Botox on it, usually I would say once every 6 months, this muscle becomes weak and paralyzed for a time being. You cannot clench, you cannot grind. So potentially, this is one of the most surest ways to stop yourself from grinding and clenching. Um, these are the three options that I always give to my patients. Three options available to them. I grind, and I basically would prefer to have the injectable, not to have to worry about my guard, where it is it clean, stuff like that. And as I said before, meditation, really important. We don't take it seriously, but if you're clenching and grinding because of stress, keep in mind that something's going on here that's really trying to get out of you. So let's calm it down. You are Melbourne or Sydney? I'm in Melbourne. So that's all you need to know about crunching and grinding. If you have any questions, drop it in the comments. Otherwise, my explanation this morning is done. I'll wait around for another 5 minutes if somebody has any questions. And sorry for all the lights and shadows and everything. I am walking toward work. Maybe I should buy a selfie stick or something and come off like an influencer. All right, I'm just waiting for your questions. If you don't have any questions, in about a few minutes, I'm going to end the live. And feel free to ask me any questions you have in the comments, because that's how I get ideas on what you guys want to know and come back here and have a chat with you. All right. I guess there's no more questions. Nice to talk to you this morning. I'm going to go get my coffee and go to work. And I'll see you in the next one.